Perfect.
Awesome. Well, let me just start by sharing a little bit about where I work. As Dana mentioned, I am at NORC at the University of Chicago. However, my office is located in Bethesda, Maryland, right outside of Washington, D.C. And for those of you who may not be familiar, NORC is a nonpartisan, nonprofit research organization, and we conduct a lot of the large surveys that some of you may have participated in, with the National Immunization Survey and the Medicare beneficiary surveys, among others. And the work that we've done over the years has really evolved. And so we also do a lot of work in the area of evaluation. And for example, we are evaluating the Pennsylvania rural model, the global budget project in Pennsylvania. So we do a lot of work for the Centers for Medicare and Medicaid Innovation, as well as the Centers for Medicare and Medicaid Systems. So we do a breadth of work across healthcare and public health. And our Walsh Center is almost 25 years old now, and we are the only rural health research center that is located in the Beltway. Can you see the whole slide now, Dana?
Yes, well, on the site it shows the next slide kind of like as a precursor, but it's pulled up.
I'll just see if I can. Is that better?
There, yep, there we go. Now it's the full screen.
Okay, fantastic. Okay, excellent.
I didn't look up.
Okay. And so I've been asked to speak today about the social determinants of health, and we're just going to make sure we're all on the same page with regard to what we are talking about with the social determinants of health. We're really talking about all those different factors that contribute to health and well-being. And we look at some of the root cause contributions that really have an opportunity to make a positive difference in health. And you may have seen this particular slide before. This is a slide that has been developed by CDC, looking at healthy people. And one of the things that's really interesting about this is that when we talk about social determinants of health, we're really talking about all the different facets of life that contribute to where we live, learn, work, play, and pray. All those different pieces. And, you know, if we start going around the circle, certainly all of you are well versed on the importance of having access to quality health care, access to primary care. Certainly now we are reminded how important public health is, and ensuring that we have information about contact tracing and the like. All those types of issues really contribute to that health and healthcare component. Then when we look at social and community context, what we're talking about there is that issue of social cohesion. And I always think about growing up on a wheat farm in Frontier, North Dakota. I'm very much a kindred spirit to all of the rectangular states in the Great Plains. There was a real sense of connection. And this particular element of the social determinants of health, I think, really connects well to our rural America. This also includes things like civic participation, and it also provides some insight about people's perceptions of discrimination and equity, which is front and center as well during this time. Then when you look at education, education is important. It contributes to often to people's earning capacity. And we know that in many rural communities, the education attainment is somewhat lower. We also know when we move up to the next bubble that we have somewhat lower incomes, and that really contributes to overall economic stability, not only in our communities, but also in our families. Lastly, we have the neighborhood and built environment, and that includes information that contributes to quality and affordable housing, ensuring that people have access to clean water, clean air. It also includes crime and violence, making sure people feel safe, and also having access to safe food. So in a nutshell, all these different pieces contribute to the health and well-being of people and to communities. I wanted to share some information about the economic piece because you often hear that health equals wealth. And I think some of these slides really show some of the challenges that we are facing in rural America that we have never quite recovered. As you can see, this slide really depicts the difference in employment between metro, which is urban, and non-metro, which is rural. And the dark gray bar in that graph indicates the time during which we had the Great Recession, from the end of 2007 until the mid part of 2009. And what's really striking is that our rural communities have never attained the level of employment that we had in 2007. We have never been able to come back to that. And as you can see in our metro or urban areas, they have far surpassed where they were at that time.
Bless you.
Oh, yes, bless you. So you can see that there's a great difference in economic attainment in not only it affects personal income, but it also affects communities. Likewise, we continue to see poverty rates higher in our rural communities, which are depicted in blue, as compared to our urban communities, which are depicted in orange. And again, this has been pervasive since the 50s. Although the difference has decreased over time, there continues to be a difference of about 4% that we have not been able to close that gap. Likewise, when we look at poverty rates by race and ethnicity, again, the blue indicates our rural, and the orange is our metro or our urban. And as you can see, across all race and ethnicities, our rural people, our rural residents, experience higher rates of poverty than our urban residents of in the same race and ethnicity categories. And again, when you look across this, we're looking at upwards of 1/3 of all Black African Americans in rural communities are in poverty, which is closely followed by our American Indian and Alaska Native residents. And lastly, I wanted to share the poverty rates by age groups. And I think this is really important because, as you can see, 1 out of 4 of our kids in rural America are living in poverty. And this means that they are having less access, if you will, to broadband and to other supports that other children are able to take advantage of, and that will follow them the rest of their lives. We know that children who grow up in poverty have a much higher probability of remaining in poverty over their lifetime. So as you can see, in every single age category, once again, our rural residents are living, more likely to be living in poverty than our urban residents. So what does this all mean? One of the things that our colleagues at the Federal Office of Rural Health Policy charged us to do was to find some different examples of where programs and different types of interventions have worked really well in rural communities to improve the health and well-being of rural residents. And one of the things that we learned when we started looking at different types of programs was that there has been a lot of investment by foundations and by the federal government in implementing programs in urban communities, but not the same level of investment in rural. So one of the things that we were charged with from the Federal Office of Rural Health Policy was to start developing an evidence base of different programs that have been successful in rural communities. And so when we started looking at the different types of programs, we identify evidence-based, those that have, for example, some rigorous evaluation where they've maybe had publications in multiple journals or they've been implemented in many different places. And we also included promising rural programs as well. And those are different types of programs or interventions that have been evaluated at a local level and have been able to demonstrate that they were able to make a positive difference. And I think one of the most important things to consider is that we know we can't just plug and play rural programs in from urban communities. We often need to adapt them to fit the rural context. So we have gone out based on different topic areas to look at what programs work the best. And so when we identify these programs, we interview them, because what we know in rural is that we like to learn from each other. And the best thing to do, people in rural communities are very busy doing great, good work, but they may not have all of their work in peer-reviewed journals, for example. And so we conduct a number of interviews across the country with different program directors that have implemented these programs to learn what worked really well, what facilitated their success, as well as to identify what might be some considerations for other communities to avoid. And I'll give you an example of what I'm talking about. When we did our transportation toolkit, one of the communities that we interviewed said, you need to be somewhat cautious of volunteer transportation programs, because you need to understand that if you have people that are being transported in a volunteer's car, that person assumes the liability if anything happens. And so if you are looking at having some kind of a transportation program, for example, affiliated with a healthcare provider, it may be best to have the actual vehicle be owned and insured by the actual healthcare organization itself, so that that individual does not assume personal liability for transporting other patients. So those are some of the things that we identify, because we don't need to reinvent the wheel. People are way too busy in rural America to have to keep learning some of these lessons over again. So if we can call them together, we can put them there, include them in the toolkits so that you're able to identify some issues for consideration, as well as those opportunities or facilitators that really contribute to success. And lastly, we disseminate these lessons learned through these evidence-based toolkits. And the Rural Health Information Hub, which I hope everybody knows and uses, the link to the Information Hub is included there. And in addition to the Rural Evidence-Based Toolkits, there's a whole section on models and innovations. And all of those models and innovations are also included a category as to whether or not they have demonstrated evidence in a rural setting, or if they are effective or promising. And so you can go through and look at that information. You can identify the person who has implemented or is currently working with that program, and you can contact them directly and learn more from them, or be able to reach out if you have any questions. So with that, I'm just going to share a little bit about the toolkit that we developed that is specific to social determinants of health. And as I mentioned, this really is a comprehensive toolkit that includes a lot of background information, and all of our toolkits are set up in this modular format, where we include an overview as part of the introduction. Then the second module includes different types of program models. And then we have what's called the Program Clearinghouse. And the Program Clearinghouse has programs that we interviewed and are featured in the toolkit. And again, there is information regarding the contacts for the program implementers, because we know rural people like to talk to other rural people. So you can go to those Program Clearinghouse examples and be able to find programs and the program implementers. The fourth module is information on implementation, including considerations. The fifth module provides some background information on evaluation that may be helpful as you're looking to determine whether or not the program that you are implementing is making a positive difference. And the sixth module provides some ideas on sustainability. And lastly, there's information in the seventh module on dissemination. I'm going to just go through briefly a little bit about what is included in the program models. And in this particular toolkit, we have 5 broad categories. And we have featured 22 different models within these 5 broad categories. And so, for example, looking at programs that improve economic stability in rural areas, some of these programs feature information on place-based entrepreneurial efforts that have been successful in rural communities. Likewise, looking at different ways that rural communities are leveraging their recreation assets to enhance economic stability. So that particular model area has a lot of information if you're interested in that economic component. Likewise, the education model has different ideas for early childhood education. One of the comments that we continually get when we go to rural communities is the challenge about finding adequate childcare and early childhood education. And we include some examples in this model to give you some ideas about what programs have worked in other communities. With regard to the social and community context, this one really looks at how different rural communities have leveraged some of the assets in their communities and really looked at bringing people together from more of that strength-based lens to identify what priorities are to address any type of issues that their community may be confronting, such as food insecurity or looking at adequate housing. Health and healthcare, I think all of you do this really well, and I'm also here to learn from you today. So hearing more about some of the great good things that you folks are doing in this area. One of the things that has been very successful in addressing social determinants of health has been the implementation of community health worker and care coordination programs. And I'll speak a little bit more on that as well. We are also seeing some very interesting remote access programs. There are some really interesting ways that people are being able to leverage patient monitoring to be able to support particularly older adults who would like to remain in their homes and who may need some support in monitoring their health, such as congestive heart failure. So those are some examples in that arena. And then lastly, we have neighborhoods in the built environment. And an example that is included in this model is looking at health in all policies. And some rural communities are keeping the context of health front and center whenever they're looking at new policies to support their communities. And so these different types of program models are available and examples are provided. And we also see some combinations that come together as kind of like hybrids. And I think you will find this to be a very robust toolkit with a lot of great examples. Rural America is going full speed ahead in addressing social determinants of health. And there's a lot of very innovative communities that are making a positive difference in the health and well-being of their residents. We also have a number of toolkits that also relate to social determinants of health. As I mentioned, care coordination and community health worker toolkits. Those particular toolkits really focus in at that patient-centered need, and that's where we see a lot of opportunities to address social determinants of health. And I'm going to share an example of one that I heard when I was in Iowa. And it was really quite compelling. When I was visiting a community health worker project, I was told about a gentleman who continually came to the ED with UTIs. And every time they would talk to the gentleman about, how do you prevent a UTI, he was always very clear that he needed to drink more liquid and he needed to, be able to take good care of his hygiene and likewise, but he would continue to show up. And so they decided to send the community health worker to his home. Well, guess where his home was? His home was in the back of a machine shed. And for those of us who grew up on a farm, the back of a machine shed does not necessarily mean it's a very warm or a very conducive home to hygiene. What the community health worker learned, one of the reasons he had so many UTIs was that there was an outhouse. He had no running water. So not only did he have to carry his water, if he needed to use the restroom at night, he had to walk outside. And he was very concerned about falling in the snow and the ice in the dark because of the winter conditions. And so the community health worker talked to him about his living arrangement and asked if he needed some additional support. And he said he would greatly welcome some support to get into a different living environment. And so she was able to link him to different types of social services. They got him into an apartment. The churches in the community all rallied around him and they were able to furnish the apartment, and they were able to get him on Meals on Wheels so that he was able to get regular nutrition. And he had running water and he was able to shower and be able to drink adequate amount of water and have a restroom indoors. And guess what? His UTI visits to the emergency department stopped. And, to me, that's just such a compelling example of if you're really going to make a difference in this person's life, you need to get to that root cause. What is contributing to that person's frequent use of an emergency department? Even when you talk to them and they tell you all the right things that they should be doing, their home environments may not be supportive of them being able to adequately take care of themselves. And I think particularly for those of us who grew up in rural America, people are very proud and people are very apprehensive about asking for help. And so when a trusted person from the community comes out as a community health worker, it just really provides a nice bridge to be able to identify what the challenge may be and help to offer solutions that meet that person's need. Likewise, we also have a food access toolkit that provides some really good information, particularly for food insecurity. We know that there's a lot of people who face that, particularly now with so many people that are unemployed. The Health Networks and Coalitions Toolkit is also an excellent toolkit that helps to give you some additional ideas and tools to be able to bring different groups together. What we found to be most effective is really having cross-sector groups come together to address social determinants of health. Of course, health promotion, disease prevention, looking at services integration, how can healthcare, public health, behavioral health, social services, oral health, how can all those different types of services come together? I talked to a rural FQHC about 2 weeks ago, and they said they needed to really enhance their capacity to support with helping people to file unemployment claims because a lot of their patients did not have access to broadband. So, from a service standpoint, the FQHC said that not only do they need to provide healthcare, they also need to support people where they are, and getting access and having the ability to have someone help them navigate some of these websites was really important to their patients' health and well-being. Likewise, there's some examples of some different telehealth programs that have been very successful. And lastly, transportation. And I have to say, in the work that we have done over these past many years, I have never been to a rural community that hasn't identified transportation as one of the top 3 issues that they try to address, particularly for some of our older adults. Most of our rural communities certainly don't have public transportation, and Uber has not come to them. I grew up in Towner. I actually grew up, as I said, on a farm from Towner, North Dakota. That's a population 532. And there is no Uber, there is no public transportation. There's a senior bus that comes once a month that picks up people at 7 a.m. to take them to Minot and comes back at about 6 p.m. at night. And for frail older adults, that's a very long time to be on a bus and not in one's home. So that Rural Transportation Toolkit provides some really interesting options for you to consider. And then lastly, I'm just going to share another resource that we created that you might find useful. This was released last August. It's called the Rural Healthcare Collaboration Coordination Guide. And this was really targeted to folks like yourselves, leaders in our rural health organizations. And this entire guide was informed by local and national rural health folks. And it provides 2 in-depth case studies, one in Missouri and one in North Dakota. And it really provides, I think, some nice information for rural providers to consider as we look at how collaboration and coordination really support social determinants of health. And on that page was also the internet address URL for that. But you know, one of the things that we really wanted to convey in this document is that our rural providers have very unique challenges. And when you have limited economies of scale, when you have a lot of dependence on Medicare and in some cases Medicaid, and in some areas we just have some low patient volumes, we still need those providers out there to provide that care. And we know that we have limited resources as well. So how can we call these resources together to really be able to support the access to the necessary healthcare in our rural communities, to be able to not only address health issues, but also to provide that economic engine that a lot of rural communities rely upon. And as we've gone from volume to value, we are even more, we have even a greater understanding of the importance of addressing some of these issues. For example, when providers are dinged, if you will, for not having having readmissions in less than 30 days, really understanding the social determinants of health. I talked to one Montana provider who shared with me that the most important thing that their community was able to do was to work with the tertiary center that did most of the orthopedics, so that in the wintertime, there was a coordination so that when the patient came back to their home community, that there was at least the walk shoveled and making sure that the person could get into their home without having challenges. And so, you know, really thinking about how that transition of care works and how to be able to identify what is going to be best to keep people in their homes and to make sure that people are getting the right care at the right time and in the right place. The guide is arranged in these 4 sections. And I think this is really helpful as people are looking at how they are going to develop some collaboration and coordination efforts. There's a lot of environmental factors that contribute, and being sure that everyone is on the same page about understanding what those are, particularly in the payment and delivery side. That's really important. The second element was looking at how to really engage effectively with potential partners. And again, one of the lessons learned from the many interviews that we conducted for this was sometimes you just have to come together for the good of your community. And that may mean thinking outside of the box and maybe leaving some of the priorities that you walked into a discussion with, leaving those off the table to be able to really be able to work together and to develop a collective strategy that really is going to meet your community's needs. And lastly, the most important piece on this is to make sure that when you're collaborating and coordinating with other entities, you still have to be in compliance with the rules and regulations that your organization is required, be it regulatory compliance or in some cases, some of the collaborative efforts included getting some legal counsel just to make sure that everybody was in accordance with what they needed to do to be able to continue their activities under their licensure. One of the examples, as I mentioned, is from North Dakota, where Gerald Birch happens to be the only CEO in the country that serves as CEO of the FQHC and the Critical Access Hospital. So if you're interested in learning how he was able to make that work with his respective organizations and how the community came together, that information is included in this guide. So I'm going to summarize this because I think we need some time to have some questions and some dialogue. But I just wanted to summarize some considerations to address in addition to the resources that I've shared. One of the things that we have learned is that it's really important to demonstrate the value of any programs that are addressing social determinants of health. That return on investment is really, really critical. And I've worked with a lot of transportation providers and healthcare organizations that are looking at how they can leverage dollars through an accountable care organization, for example, to demonstrate that paying for transportation saves money in the long run with regard to missed clinical appointments and reducing ER and hospitalizations. So looking at how to put a dollar value on that return on investment is really important. And in order to do that, it really requires that you address those upstream issues, those root cause issues that are contributing to the issues that people are addressing, such as that example I shared with you about the gentleman in Iowa whose living conditions were really contributing to his high utilization. It's important to address those where the problems begin. Likewise, we also talk about the importance of promoting community participation in any kind of evaluation of these kinds of efforts. Really understanding from the patient and the family and the caregiver's perspective, how do efforts to address social determinants of health, what does that mean? And I was interviewing some people that were caregivers in a community health worker program. And one of the comments that they shared with me was that as a caregiver, they could then reassess and be the role of an adult child again. They weren't the care coordinator, or they weren't the person that was having to address all of the different navigation issues. They were able to focus on that relationship as an adult child and a parent. And they were very grateful that that community health worker was able to step in and be able to take on some of the burden that they had in trying to coordinate that loved one's care. It's also important to consider special populations when you're thinking about social determinants of health. And I actually had an example from one of your colleagues in Nebraska when we were talking about COVID and some of the unique challenges that rural communities were facing. And our rural communities in many areas are very diverse, and there's different types of cultures that come together. And in some rural communities, we have a Muslim culture, and the perspective is that, you know, they are protected by Allah, they're supported, and their health is left in Allah's hands. In other communities, the whole concept of social distancing is so incredibly foreign because it is so critical that multi-generational families are able to come together on a regular basis. If people have different exposures, if they're working in areas that have high COVID rates, bringing all those people together may not be very safe, but yet that is in contrast to the culture that they experience. So thinking about when you're addressing some of these issues about how to support people's health and well-being, how can you do it in a manner that is in a context that really resonates in these different cultures that we have in rural America? And one way to think about how to address that may be looking at different types of training that are available. One of the most effective training to address social determinants of health is actually motivational interviewing. So for any of you that are interested in looking at providing additional training for your staff, motivational interviewing has been touted by almost every single community health worker and care coordination program that we have interviewed or evaluated over the last 10 years. It's very foundational to the work that they do. And lastly, for all of us in rural, we're always looking for ways to leverage reimbursement opportunities to address social determinants of health. And the chronic care management and transitional care management codes in Medicare are two ways that you may be able to do this in terms of community health workers. I know in Nebraska, you had a program, the care coordination program that was funded through the Federal Office of Rural Health Policy. And that program provided a lot of additional training for community health workers who were primarily working within the context of TCM. And they were very successful. And I believe that was with SERPA. So, you know, there are some ways to be reimbursed to be able to leverage some of those opportunities, but some of the social determinants of health may be addressed also through community partnerships, faith-based partnerships. There are many different ways to look at how to support the needs of the residents in your community. And with that, I'm going to leave a commercial for our friends at the Rural Health Information Hub. The Rural Health Information Hub is funded by the Federal Office of Rural Health Policy. It is the one and only rural health information portal in the country. And what is really helpful, if you have any questions or you would like a customized search, you can either contact the 1-800 number or send an email to info@ruralhealthinfo.org, and you will usually get a response within 24 hours. This is your resource. Everything is free. So please take advantage of it. They are an absolutely tremendous organization, and they are here to serve. And lastly, if you have any additional questions or if I can provide any additional information after today, please let me know. I'm here also to learn from all of you. So thank you again for the opportunity, and I look forward to your questions and comments.
Wonderful. Thank you so much. That was great information. Does anybody have questions? You can unmute yourselves and ask. Otherwise, if you want to chat and questions, I can read them also if you're more comfortable with that. Anybody have questions? Comments?
Could you go back one slide and show that phone number again?
Oh, sure. Let me go back here. Let me see. Oh, goodness. Is it this one? that it?
Yes. No, no, back one more.
Mhm. Certainly.
Yes, that one, thank you.
And that phone number and contact information is also on their website. And their #1 question that they get are questions that come in regarding funding opportunities.
Other questions? Okay, if nobody has other questions, or if you're too shy, you can email Dr. Knudsen personally and she can address those for you. I guess that wraps up for today. Our next webinar will be 1 week from today at noon, again on June 17th. And that will feature Nihai and H4 Technologies, talking a little bit about the data collection piece and kind of some more of the IT behind the collection of information regarding social determinants of health. So I'm looking forward to hearing that. And thank you, Dr. Knudsen, for your time today. It was wonderful and great information. And we will wrap up. If anybody has questions, you can email me or Dr. Knudsen, and we look forward to seeing you next week. Thank you.
Thank you.